do like this. It is like this, pressure on a point.
Okay.
Those
Just a second,
points.
ma'am. I will start the streaming on YouTube, and then we will be ready to go, ma'am. Just a second.
I just silent my mobile.
Yeah, we are live on YouTube as well as on Zoom, ma'am. Okay. Good evening, participants. Welcome to the live session for the courses Foundation Certificate in Palliative Care 1, Basic Certificate in Palliative Care 2, and Certificate in Integrative Palliative Care 3. The examination for the Certificate in Integrative Palliative Care course is on 27th of April. That is the third course. The examination is on 27th of April. And for the first and second courses, it is on 3rd of May. So we thought of scheduling a session with the course instructors, core course instructors, and then clear the doubts. So right now, only one student has joined. Ms. Lakshmi Pandit, do you have any queries? You can unmute. You can introduce yourself and then ask the queries if you have any.
Yes, sir. Actually, if you just highlight the rehabilitative area of the palliative care, just few points. Rehabilitative care on the palliative aspect.
Just a second.
Yeah.
Are you able to? Yeah.
Lakshmi. In rehabilitation, we have to have a multidisciplinary team like a physiotherapy, occupational therapy, acupressure specialist. So, as per the requirement of the patient, we can enroll the team member for the various rehabilitative procedures. Like a patient of what you call stroke, who is bedridden and who is not able to walk, he will need support from physiotherapist to gain his muscle power and start walking with the support like that. Yeah. Then a patient having small injuries in the hand or feet, they will need support from the occupational therapist to make their fingers and small muscles work. And Colonel Joshi, you want to describe about the acupressure?
No, wait one. About rehabilitation, it's basically a new entry into the field of palliative care. When we talk about rehabilitation, who are the people who really needs rehabilitation? That is the people who are made with accidents. They got severe damage in their legs, hands, like this. So basically, in the process of rehabilitation, the burden is mostly on the physiotherapist and the patient. Rehabilitation is something very huge. I'm just telling you, while playing golf in 2002, I fell down in the golf ground, and I had a pain on my right wrist. I kept on doing physiotherapy for at least 3-4 years, and now you just see I can do everything. Otherwise, earlier I could not move my hand. And the physiotherapy training I took initially with the physiotherapist, but then I started doing it at home only. And I was not doing anything. Just like this, 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 continuously for 5-10 minutes. So rehabilitation can be done, but it requires lots of patience, and people have come out of those, crippled stages and they started walking. Otherwise, palliative care is basically for pain management, symptom management, and for other diseases. So that is what I believe. Dr. Geeta Joshi can just elaborate on this.
Okay, sir. Thank you, sir.
Okay. Hello, Naeem. Good afternoon.
Good afternoon,
Naeem.
madam.
Hi, how
Good
are you?
afternoon.
Show me your face.
Okay, ma'am. Okay, sure. I'll just come. Hello. Hello,
Naeem,
sir.
happy to see you.
So nice to
Thank you,
see
sir.
you.
Thank you. Thank you, ma'am.
Of course, you had told me that you want to join this course, but I never thought
Yes.
you will be here.
No, sir. I joined, sir.
And
And
you
I'll
joined
be
and
giving.
you are here in the Zoom meeting also, Good,
Ah,
Yes, sir.
excellent,
Yes. Yes, sir. Yes, sir.
yeah.
How
Any
are you, sir? How are you, madam?
All
good,
fine. And
good.
how's everything at your home?
Yes,
Children and
sir.
everything? Yeah,
Yes, sir. It's all good, sir.
all good, Chalo.
Yeah.
Thank you.
All good. Yes,
So,
sir.
any question from anyone else?
How are you, madam?
I'm good.
Yeah. No, ma'am. This third level was very easy, ma'am. And it was all
Uh,
perfect blend of Reiki and all modalities.
yeah,
Yeah, madam.
complementary therapy.
Yeah, complementary. It was
Complementary
a very
therapy.
perfect
Same.
blend of all complementary therapies, madam. It was easy.
Yeah,
In
tell
fact,
me any other question?
Dr. Kamlesh,
Dr. Kamlesh, please introduce yourself.
Hello.
yeah, Dr. Kamlesh, good evening. Please introduce yourself.
Hello. Am I audible?
Yes,
Yeah,
yes.
yeah, 100% we can listen to you. We can hear you
Okay.
properly.
Okay. I'm a senior professor in a dental college. I joined this course out of curiosity and gaining the extra knowledge. So I'm always interested in such things, palliative care that we haven't been taught, never ever.
Which course were you doing? First, second, or the complementary and alternative medicines, CAM? You see,
I'm
we are basic. Uh,
basically I'm dentist.
okay. No,
Yeah.
Kamlesh, my question is which course you did certificate
Uh,
in basic palliative
Certificate
care?
in palliative care.
Certificate
Certificate.
in palliative.
Three, part three.
Part C, that is, it is basically about complementary medicine.
Yeah, yeah, yeah.
Yeah,
That,
that is which we discuss about naturopathy, energy healing,
yeah, that
acupuncture,
one, that one.
acupuncture. That is something very good. Particularly, you see, in CAM, in short,
Yeah,
we call it a CAM, complementary and alternative medicines.
yes.
Alternative medicine we have not discussed because it is a huge subject like Ayurveda, homeopathy that we haven't discussed.
Yes,
However, we have discussed each and every point about complementary therapy like naturopathy, energy therapy, acupressure, acupuncture, so many things, and then we finally we discussed about little bit of first aid training, So
yeah.
generally we covered everything in complementary therapy. How did you like it?
Uh, I loved it very much, and it helps you in day-to-day life also.
Yeah,
Just
that's
keeps you
good.
healthy and keeps you going on.
Yeah. You see, the most important point is you can do it yourself and you can learn by doing it. From your
And
own
you,
experiences, you can keep on learning.
yeah, and you can guide others also.
Yeah, 100%.
So,
Like diet therapy or water
yeah,
therapy, you can
yeah,
do at home. And water
sure.
therapy, it works wonders, with anybody.
Yeah.
I am about 75 years of age. I generally go for a walk, and sometimes my soul of the leg, pain. Then I
Yeah,
make it a water therapy.
yeah. And thanks for starting this course, and this is really very helpful.
Thank you, Kamlesh. Where do
Thank
you
you, sir.
stay, Kamlesh?
Lucknow.
Lucknow, beautiful city of Nawabs. Chalo. Okay, nice.
Thank you.
Thank you.
Thank you.
There are other people
Yeah, two more
who
learners have
can
joined. Moons and then Shruti.
shoot.
Yes. Do you have any doubts? Can you unmute yourself and ask your doubts to our instructors? Geeta ma'am is here and Yashaman Joshi sir is here. Ma'am, shall we look at that courses which we received through the Google form? Can we discuss those, ma'am?
Yeah. Yes.
Sure, ma'am.
You tell me the first question.
Yes, ma'am. So a few questions we received through the Google form. And the first question for Geeta ma'am is, what are some common pharmacological interventions for managing nausea and vomiting in
Yeah.
palliative care, and how do they work? That is the question from one of the students, ma'am.
Yeah. Usually in palliative care, we practice both pharmacological and non-pharmacological methods. Sometimes combining non-pharmacological method acts as a complementary therapy, and it reduces the dose of pharmacological drugs, and it will be very much helpful in reducing the symptoms. Uh, the common drugs which we are using for nausea, vomiting are domperidone. It is usually available in combination with pantoprazole. For mild type of nausea or vomiting, you can use PAN-D, that is pantoprazole and domperidone combination. So another is this one. Domperidone will increase the peristalsis of the stomach and push the things downwards, towards the big, large intestine and all, and that is how it will minimize the nausea and vomiting. The second one is the MSET, that is ondansetron, usually used uh, uh, for the patients who have nausea, vomiting following chemotherapy or radiotherapy, usually used in such situation. It is a centrally acting drug, and by stimulating the central CTZ nucleus, it reduces the nausea vomiting. Third, very important is perinom. Very well used in our time, in older time. It is a metoprolol used in 10 milligram dosage, 2 to 3 times a day. It enhances the gut motility, and that is how pushes the things towards the large intestine and out of the body. So it can cause diarrhea in patient or increase frequency of the stool. But it has a one very dangerous side effect, that is extrapyramidal system activation, and uh, that is very threatening. But if the antidote like atropine is available, you can easily control it. So it should be used with caution, and like 1 or 2 tablets per day usually doesn't harm, but some people who are sensitive can have a extrapyramidal side effects with even single dose of metoclopramide. So these are the three drugs used in in our pharmacological thing. Fourth one very important is dexamethasone, usually used for the nausea vomiting induced by chemotherapy induced nausea vomiting. It can be given in injectable form or oral tablet also. I
Thank
think
you, ma'am. Yeah.
I have answered all the things.
Yes, ma'am.
Thank you.
So let's move on to the next question, ma'am. The second question is, discuss the causes and management strategies for massive hemorrhage in cancer patients, particularly those with head and neck cancers.
Yeah. See, in patients having head and neck cancer, usually the bleeding is because the tumor is lying on a big vessels in neck, like external carotid, internal carotid, vein or artery, and the tumor invades these blood vessels. The blood vessel ruptures, and patient has massive hemorrhage. Uh, uh, like a huge metastatic node in the neck, cervical region, then tumor of the base of the tongue, which is invading any large vessel at the throat or at the base of back of the throat or blood and base of the tongue. So these are the tumors which are likely to bleed. Usually, nothing can be done if it is in advanced stage, and very massive hemorrhage. It is difficult to control. In this case, usually, I mean, patient is on palliative care for advanced stage of the disease. we know the status of the disease by seeing the CT scan. So in CT scan, we know that this tumor is likely to be very near to the blood vessel, which is likely to rupture. We inform the patient and relatives, caregiver, then such situation can happen. If it is a minor bleed, you can give tablet Trenexa, 500 milligram 3 times a day. If it is a major bleed, we tell the relative to cover the site with dark cloth and sedate the patient. They keep patient calm by giving morphine or midazolam and cover the site with a dark cloth. And we tell the relative that no pressure can be given in this situation. Very few bleeds in oral cavity can be, if it is not very massive, surgeon do prophylactic or on the spot external carotid artery ligation in the neck, and that can control the bleeding. But usually in advanced disease, this is also not possible because there is no area, open area left for to carry out the surgery. So this is the very emergency like, but nothing much can be done.
You, ma'am. Now let's move on to the third question. The
Yeah.
question is, describe the subcutaneous route of drug administration and its relevance in modern palliative care. What are the common sites for subcutaneous injections or infusions?
Nowadays, nowadays subcutaneous route is not much used. But yes, of course, this is very important in certain situation, particularly when patient is on home care, and uh, you can put the butterfly in the subcutaneous site and leave it as it is, and even patient's caregiver, if they are trained, they can manage this route. And this is usually used for certain emergency drugs like giving sedation, giving analgesia like ketamine, and giving slow fluids in case of a patient very much debilitated, highly dehydrated, and just to keep, and there is no other route available like nasogastric tube or IV access and all such thing. In this, you can give subcutaneous infusion of one ringalactate or DNS over a period, 1 pint over a period of 24 hours. I'll just share one slide where I don't know how to share.
Yeah. So you want to open a PPT, ma'am?
There is one picture I have kept on desktop.
Okay. First you have to open that picture,
Uh,
ma'am, and then screen share, ma'am. So yeah,
uh,
first you open the picture, ma'am.
okay, okay, I'll
Yeah.
just.
Yes, ma'am.
There is a label down below, share screen.
Yeah, share screen, ma'am clicked, sir, but she did not
First, I have to open the.
yeah, open that one so that she can share that particular document, sir, or image, sir.
Yeah, thank you, Murli.
Yes, ma'am.
Yeah,
Now, yeah, able to view, ma'am.
it is visible.
Yes, ma'am, it is very much
Yeah.
visible.
Okay, so these are the sites for subcutaneous injection. One is abdomen, front of abdomen, side of the arm, and front of thighs. This is usually chosen in children or infants. And if patient is, you are carrying the patient in prone position, these are the sites on back of the shoulder and side of the arms, right? So these are the common sites for the subcutaneous puncture, and you can use a, um, it is, we call it butterfly, the small needle butterfly. It is inserted into the subcutaneous area, and then it is connected with the injection or IV fluid bottle. Uh, the area should be hair free as far as possible, and should be flat so you can fix up the butterfly properly. So
Thank you, ma'am, for addressing that particular query. Now let's move on to the fourth question. Explain how first aid training empowers individuals to respond effectively during medical emergencies. Give real life scenarios where this training can
yeah,
make a difference.
Colonel Joshi, you want to add this question? First aid training.
No, no, you just carry on. First aid training.
Okay. So, in case of first aid, if a person has undergone first aid training, like recovery position or position for transportation of the accident victim, then this will be useful. Like a person who is trained, a volunteer is trained in this, then if he happens to see a accident site, they can help the if there is any medical aid is available, or he himself can give the victim a recovery position, or if we shift the help the people to shift this victim without causing more injury into the spine and all. So these are the area um, uh, where volunteer who has undergone first aid training can then, in case of drowning, they will know how to keep the patient victim prone, and how to take out the how to give push to bring out the aspirated fluid from his lungs. And these are the few examples I can say.
So Shalini wants to answer this question, Murli. Can you give her access?
Question pattern. Which one, sir?
Shalini, something is written.
Yeah. Can you explain regarding question pattern for examination? Okay, Ms. Shalini is asking what is the question pattern. So in the examination, 50 questions will be asked.
Okay, okay.
It will be of objective type questions. So multiple choice questions, similar to the assignment type questions. So exam duration is of 3 hours, and you have to answer 50 questions, and there is no negative marking for the wrong answers. Shalini ma'am, can you introduce yourself?
Yes, sir. Very
Yeah.
good afternoon to all the team members, especially Dr.
Oh,
Joshi and
Shalini, how are you?
sir. Hi, ma'am.
Yeah,
All are you? All are you?
yeah,
Again,
good.
I'm seeing you. I'm
I
very
thought
happy
you
to
have
see you.
forgotten palliative care.
No, ma'am. No, I'm performing all that which I learn in your institute, ma'am, and in course of palliative care, in certificate course which I already done. So,
Okay.
as per your suggestion, I'm joining this course 3. And I am now studying this course for exam. 27th, we are having the exam.
Yeah, yeah. Murli, she came to my center for 1 month.
Oh, yes, ma'am. You told no
She is
last
a
month.
great help.
6 months
Shalini
back you
came
told.
from
Thank
Bud.
you, ma'am. Thank you for this opportunity. I am very happy, and my institute is one of only
I,
me to doing this internship
I like
Okay.
your
my place.
enthusiasm. She came
Shalini
all
came
the
from
way from
Vardhan.
Nagpur.
Gita,
Yes, sir. Yes,
Ah,
sir. Yes, yes,
you came from Vardha, I believe. I wanted to meet you, but
yes,
I was
sir.
in the. Okay, okay. You
yeah,
see,
yeah.
what a coincidence. Now you are also here. Naeem also came in after so many months. She's meeting us.
Yes, sir.
Ah.
Thank you, sir. Thank you.
Naeem, now you take some inspiration and come to my center.
Yeah, ma'am.
Yes, ma'am.
Sure, ma'am. Sure.
Stay
Yes,
with
ma'am.
me.
Yeah, sure, madam. Sure.
Yeah. Naeem has asked one question. Shall I answer that
Yes,
first, and then we go on about the exam pattern?
Yes, ma'am. Yes,
So,
ma'am.
yes, ma'am.
Naeem has said uh,
And that's the
that
case, ma'am, actually.
a patient has
Yes,
undergone surgery for oral cancer
surgery.
and
Yes, ma'am.
followed by radiation or radiotherapy, and now he is having fibrosis.
Fibrosis, madam.
Uh, this is very common, and particularly after surgery, also there is a trismus, that is
Yes,
inability to open the mouth, and
yes,
radiotherapy increases to it.
yes,
Uh, and secondly, following radiotherapy, there is a fibrosis of the salivary gland also. So
yes.
patient doesn't have secretion of the saliva. So all
Saliva.
the time he has absolutely dry mouth, absolutely dry mouth. So
Yes,
he
ma'am.
cannot chew the food. So
Yes,
for chewing any solid food, he has to
yes,
take a sip of water also along with
yes,
it, and then only he can chew the food. That is
yes.
one. These are the very bothersome problems. Uh, Regarding fibrosis, there are some devices to it is
Yeah, but they
it,
have not helped,
it,
ma'am.
it
Those.
it doesn't help much. It helps
Yes,
temporarily. Again, the fibrosis sets in, and it is on the same place.
yes, ma'am.
So only thing patient has to accept this situation, and he
Okay.
has to remain on liquid diet only throughout his life,
Okay. Oh
almost
my
throughout his
God.
life. Uh,
Yeah, ma'am. Uh-huh. Okay.
so liquid
So,
diet only, and but he needs lots of oral care because he's not able to open the mouth. He cannot brush
yes,
his teeth, and
yes.
so he needs lots of oral care with
Okay.
injection metronidazole, metrogyl,
Yes,
and betadine
yeah.
blockers
Mouthwash.
5
Yeah,
times a day.
condoms.
And
Yes,
in between also he keeps on having dryness, so he has to keep on having sips of water, or he can keep ice cube in the mouth. Uh,
okay.
yeah, and there are artificial saliva available which can be
Okay.
sprayed in the mouth.
Yeah.
But it is not much. It is very costly thing, and it is
Yes,
effective
ma'am.
for few hours. So repeatedly he has to
Okay.
take that. So these are
Okay,
the
ma'am.
only options we have. Uh,
Oh, ma'am.
Thank you, Naim, for asking.
Thank you. Thank you so much, ma'am. Thank you so
Yeah.
much. But yeah, patient is taking treatment in towards me, but I didn't find any improvement, ma'am. As you have said, it's a lifelong
Yeah.
process that he has to run through.
But
Thank you, madam. Thank
you
you.
can give him psychological support,
Yeah,
motivation, and
counseling,
also
those things. Yes, ma'am.
Murli can
Thank you, madam.
explain about this question pattern for
Yes,
exam.
ma'am. Yes, ma'am. I already explained, ma'am. It will
Uh,
be of objective type questions. 50 questions will be asked. Similar to the assignment type questions. If our students are have gone through the assignment type questions, then they will be able to confidently answer the final examination question papers. Would you like to add any points, ma'am, sir? Would you like to add any points related to the
uh,
examination?
Yes, Murli, I have prepared this examination question paper, and let me tell you, my dear friends, this is just not to confuse you. Understand? So try it very slowly, think over, and then go for your choice. Very simple questions. If you have gone through the presentation, almost all the presentation, I've taken out what is generally very, very bright and obvious. I have selected only those questions. I have not taken out from depth itself. I don't want to test your IQ. I mean, the we people at NPTL, we just want to see that you have gone over all the complete course and you have just got a total hint, okay, this is what this particular course means. Thank you. And all the best. You have got an exam on 27th and then on 3rd May.
Yes, sir. First two
All the
courses,
Thank
best.
you, sir.
for the
Thank you.
first two courses, examination is on 3rd of May, and the third part course examination is next week, sir, 27th
27th.
of
Yeah,
May. Hall
next week.
ticket you have got, ma'am? Hall ticket?
Yes,
Yeah,
yes,
we
sir.
downloaded. Yes,
Okay,
we
great, ma'am.
downloaded.
Great, ma'am. Best wishes,
Yes.
ma'am.
Thank
Thank
you.
you,
Geeta,
thank you,
ma'am,
sir.
would you like to add anything, ma'am, related to examination?
uh, uh, yeah, uh, uh, what I want to add is the questions are answers are there in the PPT or education material which we have given. So you will definitely find them. So read them thoroughly, and attempting the question also requires little bit focus and attention. So you will not just by mistake you choose the wrong answer and lose your marks. So it is very easy, and you'll be able to do it well. Thank you.
Thank you, ma'am. Thank you, sir. Can we move on to the fifth question, ma'am, which was asked in the Google form?
Yeah.
Yes, ma'am. The question is, explain briefly emergency scene management with some examples.
Emergency scene
Scene
management.
management. Yes, ma'am.
I explained no that. Acha, explain emergency scene.
You see, I'll just tell them, Gita.
Yeah, yeah.
You
Sure, sir.
see, emergency team management, basically, they are the trained professionals. Like what we have in armed forces or police forces, they call them quick reaction team, QRT. Now, for accidents and other things, emergency team people are there. They are located in a nearby hospital. It can be any hospital, or if there is no hospital nearby, they can be generally located. If it is a highway, national highway, 4 lane, 6 lane, they'll be generally located on the road itself. So as and when they get the warning that this is what has happened, immediately these people go over there. They have got trained people. They go with a proper ambulance. They can do some sort of resuscitation. Then they can give emergency treatment on the spot itself. And after getting that injured person little stable, he'll be moved over to the hospital immediately.
Thank you, sir. Would you like to add any point, ma'am, related to emergency scene management?
Usually, as a medico, we come across that accident and sudden cardiac problem. So in this situation, suppose patient has sudden heart attack. In this case, you are trained in giving CPR, but also trained in giving recovery position. So this patient, you first of all, make them comfortable, make them lie supine in a flat surface, or shift them to a safe area, loosen their clothes, and if they already have some medicine with carrying with them, like sorbitrate, you can give immediately to the patient. Uh, then and make arrangement. Then elevate the lower limbs, elevate the foot end. This will increase the circulation towards the heart, and this is how if sometimes during this cardiac event patient might have vomited, so you clean the oral cavity and surrounding area, and prevent aspiration. In this case, you have to lift up the jaw of the patient from the angle of the mandible, and turn the face of the patient on one side and allow that vomiters to pass off, and then clean the oral cavity with a piece of gauze or handkerchief, whatever is available. Then by the time somebody might have called for the ambulance, and then shift the patient in the ambulance, and take care that he should not meet with another accident, or he should not be bumped into something, and shift him smoothly on the ambulance bench. So this is the emergency uh, management in the cardiac event.
Thank you so much, ma'am. Now let's see the next question. The question is, discuss the importance of assertiveness in healthcare communication. How can healthcare professionals tactfully use assertive communication to address concerns and promote patient safety? I give some examples, provide examples.
Yeah,
Yeah.
Ulli,
Yes,
you
sir.
see, when we talk about assertive communication, it has got two aspects. You assert yourself. You assert yourself means the first aspect is you speak out your feelings confidently. Number one.
Right, sir.
Second thing is when you are speaking out confidently about yourself, at the same time, do respect the belief of others. You have to respect, like a patient is talking about himself or herself, the patient must respect the belief of the doctors also at that time. So assertion is both ways. Assertion is very important. Like in palliative care, we always say patient is the king. It is not what patient wants to do, because after all, it's a patient's body. So that is where in such a scenario, assertive communication comes into use. It can be used by all the three types of people. First, the patient, second is the nurse or a caregiver, and third, the relatives. Patient, how can he use? He will say, I'm having pain, I don't want this particular treatment. I'm free to select a doctor, anything. I don't want any immediate treatment. If the patient is very sick, he's already crossed 75, 80 years old, he doesn't want to undergo any major operation. This is his right. So he can use this assertive communication very politely without hurting the doctor, patient. Second, caregivers or rather nurses. I always believe that nurse spends more time than the doctors with the patient. You all agree with this. Doctors come and go. They just inspect because there's to see number of doctors. At the same time, they have to go to OPD and OT and other things. But we have got special nurses selected and they stay in those wards and they stay with the doctors. Now, whenever nurse finds that this particular medication is not useful to the patient, that nurse should be able to tell the doctor, sir, we have to change this medication because it is not making any progress at all. No. She has to be bold enough. Very respectfully, she must talk it out. Last, relatives, close relatives. Close relatives, naturally, what is in their heart is the welfare, the safety of their own patient. And therefore, whenever it happens sometimes that the patient is unable to talk, patient is a comatose, he's like a vegetable, he cannot express anything. So that's the time relative will say, okay, doctor, should we do this or we shouldn't we do this? So in such things, all the three people, they take important part in this assertive communication. I have seen number of examples in Ahmedabad when we know that the patient is going to die in 3 4 days, but still we just hasten his entry into some Apollo hospital or in ICU, and they spend 30 40,000 rupees a day. ICU of single bed costs that much. What is the requirement in 4 5 days? So the patient says no, or the close relative says no, they must sit down, consider that particular request, and should keep the patient at home. That is called assertiveness in the communication. It is very, very useful. It is good for the patient, good for the family. It will save unnecessary spending of money, which can be again further required for the family. Yeah.
Yes, sir. Thank you so much, sir, for explaining that question in a very elaborative manner. And again, one more question for you, sir. When should one consider seeking professional help for grief? When should one consider
Okay.
professional
Uh, you see, we know that
Dabda concept? Yeah.
Dabda, it's stages of grief. So I'll just tell you the 5 stages of grief. DABDA. Denial, that you just say कि this cannot happen to me. Anger, गुस्सा आ जाता है. Then you bargain कि yes, ये नहीं हुआ, ये करेंगे. Then depression, and then finally accept. Now, normally this is the condition in all matters of grief. Whenever some very close relative passes away, we all undergo the same process. But normally we have seen, like in our system, in our culture, we give 12वीं और 13वीं हम करते हैं. In most of the places in India, you have certain rituals, 12 12 days after the date or 13 days after things become very, very normal. If the person is very aged, it becomes normal in 3 4 days time also, because we accept. Immediately we come down to the last stage of Davra, acceptance, fifth stage. But if a patient has died, unnatural death, and the patient is young, then definitely we are unable to accept it. We just say, "Okay, God, why have you done this?" One simple principle, rather two things are there. When the grief remains more than 6 months, I repeat, when grief remains more than 6 months, I think it is better to take professional help. Number one. Number two, if it becomes complicated grief, you see, in one grief, you are just lying down in your room, you don't speak to anybody. But it becomes complicated. You don't speak to anybody, you don't take bath also, you don't take food also. So many things happen. It is hurting your body, hurting your sentiments, and your close relatives do not know what to do with you. So when your grief becomes complicated, it is the time to seek professional help. But normally I haven't seen in such grief, which is the major, what are the causes of grief? Normal causes: you lose the job, your house gets destroyed, your children they fail in the exam. These are normal. You don't like it. Major causes: you happen to undergo a divorce, wife and husband separates. It is a major cause. But after all, you people have taken the divorce, so in 2 3 months' time, you generally settle down. कि वो तो होना ही था, what can we do? Another major cause is when someone very very close to you die. One of the partners, either wife or husband, dies. Then it becomes really impossible for the remaining partner to. But they know, they doesn't find any aim. कि why to live now? My husband has died. My wife has died. She was my own companion. मेरी जीवन साथी थी for so many years. अभी नहीं रही मेरे साथ. So in such a case, if it extends, normally it does not in our society. I haven't seen, but it extends more than 6 months more. Then do seek professional help. They can help you out.
Thank you so much, sir, for answering that query. We have received one query from Dr. Omkar Saloki. He is watching the event via YouTube streaming. The question is, how can palliative ophthalma ophthalmic care be optimized to preserve dignity and comfort in patients with progressive vision loss due to terminal illnesses or advanced ocular malignancies? Ma'am, would you like to respond to this query, ma'am? How can palliative ophthalmic care be optimized to preserve dignity and comfort in patients with progressive vision loss due to terminal illness or advanced ocular malignancies?
Yeah. Dignity towards end of life or towards the advanced stage of the disease can be maintained firstly by reducing the suffering by very good pain management, symptom management, then keeping the patient clean. His wounds should be dressed properly, and he should be in comfortable position, comfortable surrounding. So all such will add caring for him all the time. Whatever. Suppose he wants to change his position, or if he wants to go to bathroom, he should be assisted, and somebody is always available with him. Secondly, uh, caregivers should be trained to give this care towards the end of life. So dignity towards end of life is basically relieving him of suffering and making him as comfortable as possible. Communication is very important in this situation where you explain the relative and if required to the patient also about the terminal part of the illness, what are, and address their questions and concerns. They may ask what will happen to him, how uh, he will be relieved of his life and all such things. So certain difficult question needs to be answered by communication and by counseling.
Thank you so much, ma'am, for answering that question raised by Dr. Omkar. Yashavan sir, the next question is for you. The question is related to Tai Chi. I will read the question. Describe how Tai Chi combines meditation with movement and discuss its impact on mental and physical well-being. That is the question, sir.
Yeah, this is the part of energy healing basically. How to generate energy and which in turn keeps you healthy mentally, physically, emotionally, and sometimes spiritually. All these aspects of energy healing, be it Reiki, be it EFT, emotional freedom technique, or Qigong. Qigong, it's again a martial. Qigong as well as Tai Chi, they are basically Chinese. Now, Tai Chi is generally referred as meditation in motion. But now both the things, both words, if you combine it becomes Tai Chi. Why does it become meditation? Because when you are doing all these movements, your total attention, 100% attention is just concentrated on those movements. And those movements are very slow. There is no tension involved in your muscles or in your legs or any body parts at all. When you carry out very slow, methodical, rhythmic movements, and your concentration is on those passive movements of your body parts, then it becomes Tai Chi. It's very, very useful. Long time back, I had gone to Puducherry and I was staying in the guest house of Sri Aurobindo Ashram. My room was on the third floor. On the staircase, it was written that this is the time for you to meditate. When you are climbing the stair, lift your right leg and just see, feel the movement of your right leg. Thereafter, put it on the platform of that ladder. Now, when you have to lift your body, the pressure will come on the right leg, which is basically giving you control on your body. Thereafter, you lift your left leg and again see the movements, and this is how you go up the ladder. This is nothing but Tai Chi, meditation in motion. Whenever any exercise, physical exercise you are doing, physical exercise, it can be Tai Chi also, in which normally you are pressing hands and you are moving forward. In Tai Chi, basically it is this. They do in a group also. So in the group, they put their hands like this, bend forward, and take certain steps and they move. They move in a group like soldiers move in a drill square. Tai Chi is Chinese, and I'll suggest yoga is again the same thing. It is meditation in motion because whenever you do yogic exercise, and while doing that particular yogic exercise, you concentrate your breathing, inhalation and exhalation. I generally do that only. For each yoga movement, I'm doing breathing techniques also at the same time. Sometimes fast, sometimes slow, sometimes moderate. So Tai Chi, basically Chinese, it is part of, it has come, it was a martial art sort of thing, and then came down to passive technique of Qigong. Generally, they're in Chinese, but it is now spreading in Western countries also, particularly Americans. I do not know how President Trump has come to, he might have put that 300 tariff, on the Chinese instructors. I don't know how it is going to happen.
Thank you so much, sir. One last question which we received from Google form, I will read out, sir. Briefly discuss about the difference between acupuncture and acupressure.
Yeah, this is there in India, acupressure and acupuncture, and this we have been doing since ages. Now, just two words, pressure and puncture. Simple. If you understand these two words, pressure means you are applying a particular pressure. And puncture means you are puncturing that part of the body. And how do you puncture it? You puncture it with a needle. Where do you apply this? So we call them acupoints on the body. Known acupoints on meridians. Again, you must have gone through my lectures and other things. You see, we have a system of meridians, and they basically affect your nervous systems itself. So they are both Chinese complementary therapies, but they differ in their methods of application. In acupuncture, We puncture with a needle, very, very thin needle. I don't have it here. We puncture a particular acupoint which affects your pain. Any acupressure, we apply blunt force on the same point. Gita, when you have that acupressure, that blunt force, just apply it on some part of your body like this. It is either made of some metal or made of some wood, like here, I think it is of plastic. So you apply that particular thing, and finally it vitalize the body force, life force in the body, and this way it gives you the relief. It is being done, acupressure, both things are being done here. Do not worry about the needles when you say no, where we are putting the needles, because we generally have that phobia of injection. No, it is not like it is a needle, but so sharp. In my presentation when I had given the lectures on acupuncture, in front of everybody, I just put few needles on that. What is the lots of people have got lots of faith on this both methods. Even in India also, like in Vadodara also, we have got a lot of people, acupressurist and acupuncturist, even in Ahmedabad also. So it depends basically what sort of faith is there, and it is giving a lot of relief to the people who have got faith and who are suffering from various diseases. Thank you.
Thank you, sir. Geeta ma'am, would you like to add any point, ma'am, related to acupressure, acupoint?
Yeah, acupressure and acupuncture are complementary therapy, uh, mostly used for pain management. There are many of our pain physicians are also trained in this. So, along with giving medication or nerve block, even this technique is tried, and it is absolutely non-interventional technique. So, patient doesn't have to go to hospital, get admitted, and uh, take tablets and all such thing. So it is very effective as a complementary therapy, but solely as a only acupressure or acupuncture, it is. I don't think it is very effective for any other. And some people have used this for symptom management also, like vomiting, continuous vomiting, depression, then muscle spasm, and all such areas also acupressure and acupuncture effective.
You see, acupuncture we call it invasive because we are puncturing the skin, whereas acupressure is non-invasive. That particular blunt force what we apply does not enter any part of the skin, and therefore it is very, very safe because it is non-invasive. Thank you.
Yes, sir. Thank you, sir. Thank you, ma'am. So those were the questions, sir, which came from the Google form. Let's ask the active participants whether they have any other queries. Participants, do you have any other queries? Dr. Kamlesh, Dr. Naeem.
No, sir. No, sir. Everything is clear.
Thank you so much, ma'am.
Thank you. Thank you, sir.
Yeah,
Thank
Ms.
you.
Lakshmi Pandit,
Thank you.
Ms. Shalini.
And sir,
Yes, sir.
I
Yes.
want to say that Dr. Joshi and Colonel Joshi and sir, this is a very interesting and informative session. Before that, I have not attended any type of palliative care. Palliative care, that's online course, but in this course, so many assignment and madam and sir जो all the note, lecture note and all the classes, these are also very informative and all aspects of the palliative care are discussed in this course. So thank you, sir and madam. And I am registering my name in palliative care too in this course. So thank you, sir and ma'am, from me.
Thank you, Lakshmi.
Thank you. So are there any other queries? Otherwise, we may wind up the session.
Yes, sir.
So you
Thank
have,
you.
okay. Yeah. So thank you so much, Geeta ma'am and Yashavan sir, Joshi sir, for your valuable time. So this program was organized in a very short span of time. Yesterday only we planned, and then we conducted this session since there is an examination next week. So once again, thank you so much, our core instructors, and then participants. Thank you for you as well. And then do well in the examinations. If you have any other doubts, you can post it on the discussion forum. It will be attended actively.
Thank you. Thank you, Murli,
Yes.
for
Thank you,
this
madam.
coordination. It was
Thank
nice
you so much, ma'am.
attending
Thank
all.
you so much, ma'am.
All
Thank you.
the best to all the candidates.
Thank you,
Thank you,
madam.
ma'am.
Thank you, sir.
Thanks, Molly,
Thank you.
and all the best
Thanks,
wishes to
Murli.
the
Thank you, sir.
candidates.
Yeah,
I
Thank you.
want one or two candidates from this particular group must shine. We have got that standard. I think we must have, Murli, we must have explained them. No?
Which one, sir?
People standing first, second, third in the course, they get a. Have you told them?
Actually, internship is there, sir, for the toppers of the course. There is a link for that. Students can view that internship page and get more details. I'll just share that link in this Zoom chat.
Yeah.
Just a second, so that just copy this.
How much should we score for internship?
90 and above, definitely you will get an internship, provided the instructors are also free to spend time giving
Time.
the internship program.
Naim, you
Okay.
must try. Kitabin is always free for you.
Yes, yes, sure, sir.
yes.
So,
I
sure, sir.
have the internship link on the Zoom chat. Are you able to view, ma'am?
Yeah, yeah.
Yes, sir.
We'll
Yes,
take
sir.
a
We are able to.
screenshot.
Go through it and then try to get good marks. And then depending upon our instructors' free time, let's plan for an internship program for those who secure good marks. And,
Okay.
stipend has also been increased to 15,000 per month for doing internship. And the maximum duration is like for 3 months, one can do an internship with the instructors, provided they also are available.
Yes.
So it's a good opportunity to get real life skills from our instructors.
Okay.
Yeah, so you can use this opportunity. So after the examinations, you can apply to the internships by visiting that link. So
Okay.
best wishes, students.
Yes, yes.
Yeah.
We'll-
Thank you. Thank you, Murli.
Thank you,
Thanks,
sir.
everyone.
Thank you,
Thank
ma'am.
you.
So we will end the session now, sir. Ma'am?
Okay.
So we are closing now. Yeah. Thank you, everyone.
Thank you. Thank you.
So I'm closing, sir.
Okay.